In medical school, the focus is intensely on the science: anatomy, pharmacology, pathology. The assumption is that if you can memorize the pathways and achieve a perfect diagnosis, you will save the patient's life. But a flawless diagnosis is clinically useless if the patient ignores your treatment plan. The prescription only works if they actually swallow the pill, and whether they do that is dictated entirely by how much they trust you. When measuring patient outcomes against physician trust levels, the data is striking. High-trust patients exhibit medication adherence rates 2 to 3 times higher than baseline. The impact extends to colleagues. In environments with high trust, where staff feels safe reporting errors, adverse medical events drop by 30%. Empathy and professionalism are not secondary traits you tack on if you have the time. They are measurable, operational, clinical tools that directly govern patient physiology and your own liability risk. Trust is the actual currency of healthcare. It is not an innate personality trait you are born with. It is a generated outcome, engineered through a precise, repeatable behavioral formula. The logic of a professional clinical relationship is built on dependability. That equation is defined as reliability plus consistency plus accountability. Reliability pairs clinical competence with clear communication. Consistency requires a predictable temperament. Accountability means fiercely protecting patient privacy. By actively operationalizing this equation, doctors systematically generate therapeutic alliances. These alliances reduce patient anxiety, improve clinical outcomes, and are the strongest defense against physician burnout. Maintaining that dependability equation requires a strict ethical baseline. In medicine, that baseline rests on 2 distinct pillars: honesty and integrity. Honesty is truthfulness in observable actions and documentation, like promptly reporting a medication error to an attending physician. Integrity is adherence to moral principles when completely unobserved, like refusing an inappropriate gift from a pharmaceutical rep in private. Failing to uphold these pillars carries severe legal consequences. Falsifying records or engaging in unethical practices inevitably leads to malpractice suits and the revocation of your medical license by regulatory bodies like the PMDC. Honesty is telling the truth. Integrity is living it. Together, they establish the cultural baseline necessary for team cohesion and strict legal compliance. Demonstrating these values sounds simple in theory. In practice, executing them within a high-pressure, resource-limited healthcare ecosystem is brutally difficult. You will face intense organizational pressure. In massive public hospitals, doctors routinely navigate severe overcrowding, often forced to process patients through 3 to 5-minute outpatient consultations. This is compounded by severe economic friction, with out-of-pocket payments making up 64% of health expenditure. Patients arrive under intense financial strain, often suspicious that prescribed lab tests are unnecessary and motivated by profit. You also have to navigate deeply ingrained cultural barriers. A rigid, hierarchical blame culture often punishes junior staff for reporting safety issues, while political interference and the expectation of syphilis, or nepotism, constantly threaten to override clinical triage. Under these conditions, the environment actively compromises patient safety. To survive this gauntlet and bypass cognitive overload, physicians have to rely on rigid, practiced communication algorithms. The first of these tools is clinical empathy. Unlike passive sympathy, simply feeling sorry, clinical empathy is an active, structured response. By utilizing appropriate nonverbal cues, like sitting squarely and maintaining eye contact, you can deploy empathy systematically, even during a rushed 3-minute consultation. Execute the NURSE technique to navigate distress. N for naming the emotion, U for expressing understanding, R for respecting efforts to cope, S for supporting directly, and E for exploring deepest concerns. Deploying the NURSE algorithm allows a physician to provide elite emotional care without absorbing the patient's trauma, preserving critical professional boundaries. This kind of structure is even more vital during the most dangerous communication event in medicine, delivering a severe or fatal diagnosis. Breaking bad news without a framework is incredibly volatile. It can instantly destroy the therapeutic alliance and inflict lasting psychological harm. To manage devastating information, the medical standard is the SPIKES protocol: preparation phase, setting, and perception. delivery phase, invitation and knowledge, stabilization phase, empathy and strategy. The Spikes protocol removes the guesswork from tragedy. It ensures the patient absorbs the information accurately while remaining firmly anchored to the physician's care plan. These frameworks are equally crucial for peer-to-peer relationships. In hospitals, rigid medical hierarchies frequently terrify medical students and junior doctors into silence, preventing them from speaking up when they notice a problem. To safely escalate critical patient issues, staff use SBAR. State the facts with S for situation and B for background. Then move to action, A for assessment and R for recommendation. SBAR strips emotion, deference, and hesitation from the reporting process. This structural failsafe empowers junior staff to act, directly driving that 30% reduction in ward mortality and adverse events. But the trust generated by all of these algorithms is fragile. It has to be fiercely protected by maintaining strict professional boundaries. In the local context, physical and social boundaries are paramount. That means the non-negotiable use of clinical chaperones during examinations and strictly avoiding outside social meetings or oversharing personal problems with patients. Financial and ethical boundaries are equally critical. Treating friends and family without formal documentation or accepting commission-based laboratory and pharmacy referrals immediately destroys a doctor's integrity. Compromising on these boundaries even once invites systemic exploitation and shatters the therapeutic alliance permanently. Clinical knowledge is what allows you to diagnose the disease. But operationalized communication and unyielding integrity are what actually heal the patient. The healthcare gauntlet you are about to enter is unforgiving. It will test your patience, your ethics, and your endurance. These frameworks are not suggestions. They are the required survival tools for that environment. Mastering active listening, deploying algorithmic empathy, and holding strict ethical boundaries is non-negotiable. It is the only way to build a safe, legally protected, and profoundly impactful career in modern medicine.